Yo, what's up, everybody? This is Zero, and today I wanted to talk about silicosis. And the reason for it is that when I used to work work in construction, that was a big topic that was in the safety meetings. And if you don't know what that is when your body takes in too much dust, breathes in too much dust, and it's pretty much like the dust that usually working on a structure site like concrete or sand or something like that, or even just regular dirt. And usually when you're working on sites, that dust kind of flies up in the air, so you're taking it all in your face, it's getting into your lungs, into your mouth. So I wanted to kind of bring awareness to it. So I'm going to read an article that could make it a lot clearer and maybe help people get through this. So I'm going to get into that right now. Silicosis is a lung disease caused by breathing in tiny bits of silica, a mineral that is part of sand, rock, and mineral ores such as quartz. It mostly affects workers exposed to silica dust in occupations such as mining, glass manufacturing, and foundry work. Over time, exposure to silica particles can cause scarring in the lungs, which can harm your ability to breathe. Yeah, so they get in the lungs and they start cutting up your lungs. So then there are key facts. The three types silicosis, acute, chronic, and accelerated. And it says it occurs when workers in mines, factories, sandblasting, glass manufacturing, but there's other jobs that can do that as well. And they say about 2 million U.S. workers remain potentially exposed to occupational silica, and there is no cure for it, but it can be prevented. And ways to prevent it are like using dust masks or rebreathers. Those are like the best ways. Like if you're trying to use like a bandana or something, that's not gonna work. Dust can still get through there. And when it gets on your mouth, gets in your nose, you can't have it leave up in your nose because it leaves like a big clump, so you have to get that out. I don't want to sound too graphic, but that's what it is. And they explain what three types of silicosis is. The acute silicosis, which causes cough, weight loss, fatigue within within a few weeks or years of exposure to inhaled silica. Chronic silicosis, which appears 10 to 30 years after exposure, can affect upper lung areas and sometimes cause extensive scarring. Accelerated silicosis occurs within 10 years of high level exposure. So it's like silicosis still develop within a few weeks after exposure. When people breathe silica dust, they inhale tiny particles of the mineral silica. This silica dust, which can cause fluid buildup and scar tissue in the lungs, that can cut down your ability to breathe. It can lead to lung scarring, cough, weight loss, and fatigue. Silicosis affects the lungs by damaging the lining of the lung air sacs. Once this begins, it leads to scarring and in some situations, a condition called progressive massive fibrosis. Yeah, to a condition, yeah. Okay, got that. The condition happens to be severe scarring and stiffening of the lung, which makes it difficult to breathe. Yeah, people with acute silicosis experience cough, weight loss, tiredness, and may have a fever or sharp chest pain. We have a shortness of breath over time, especially with chronic silicosis. Your healthcare provider might hear crackles or wheezing when listening to your lungs. Having silicosis increases the risk of other problems such as tuberculosis, lung cancer, and chronic bronchitis. Yeah, I remember hearing that in the safety meeting. So when I used to go to the safety meetings, they say like there's an acceptable amount of silica you actually can breathe in, which it's always best not to breathe in any if you can. And then they explain which how they each type of silicosis affects the body. So with acute silicosis, the lungs become very inflamed and can fill with fluid, which causes shortness of breath and low blood oxygen levels. With chronic silicosis, the silica dust causes areas of swelling in the lungs and chest lymph, lymph nodes, which makes breathing more difficult. And with accelerated silicosis, swelling in the lungs and symptoms occur faster than chronic silicosis. So it says over time, the lung capacity decreases and people with silicosis may need support with oxygen and other devices to help them breathe. And then they say how serious is silicosis. Silicosis can cause major lung damage and accounts for more than 100 deaths each year in the United States. And then they give symptoms and risk factors. Symptoms of silicosis can appear from a few weeks to many years after exposure to silica dust. Symptoms typically worsen over time as the scarring in the lung occurs. In chronic silicosis, you may only have an abnormal chest x-ray in the beginning and then slowly develop a cough and breathing difficulty. More than a third of people with silicosis have phlegm production and cough. Chronic bronchitis-like symptoms may occur in the lungs, have additional sound called wheezes and crackles, and extensive snoring progresses over time. You see signs of chronic lung disease such as leg swelling, increased breathing rate, and bluish discoloration of the lips. Okay, so now they give examples of what causes silicosis. Silicosis is caused by exposure to crystalline silica, which comes from chipping, cutting, drilling, or grinding soil, sand, granite, or any other minerals. Any occupation where the Earth's crust is disturbed can cause silicosis. A long list of occupations known to expose workers to crystalline silica that includes various forms of mining, such as coal and hard rock mining, construction work, like I said, that's what I did, tunnel work, masonry, sandblasting, glass manufacturing, ceramics work, steel industry work, quarrying, and stone cutting. I mean, I'm sure there's others, but those are common. But what are the risk factors of silicosis? Breathing crystalline silica causes silicosis, and the main risk factor is exposure to silica dust. You can prevent silicosis by limiting exposure. There are national guidelines on exposure limits over a lifetime of working. If you're working a job that exposes silica dust, your employer must, by law, give you the correct equipment and clothing you need to protect yourself, which they call that PPE, which stands for personal protective equipment. So, like I said, like dust mask or rebreathers, they need to give you that. It is it is against the law for them to deny you that. Remember that when you work in a job that has a lot of dust, because even though a little bit of dust doesn't do anything, if you're exposed to a whole lot of it, it can be very dangerous, and you can get these risk factors of silicosis. So then it says you're responsible for using it always and taking other steps to protect yourself and your family as you leave your job and head home. The NIOSH yeah, also recommends that medical examinations occur before job placement or upon entering trade, and at least 3 years thereafter. Yeah, I have taken one of those tests. They have a test like where they test your lung capacity to see if you can work in that job because if there's like any holes or problem breathing, they can't hire you because if you put on this rebreathers while you're in that environment, you it could actually be a lot more dangerous for you to breathe with it because you'll have a hard time breathing in that equipment. So that's why it's important for them to have uh have the medical examinations. So patients with silicosis have an increased risk of other problems such as tuberculosis, lung cancer. Yeah, we read that already. If you're a smoker, quitting may help as smoking damages the lungs. When to see your doctor. Many many person that works in industry inhale to inhale silica should get regular health checkups to be monitored for signs and symptoms of lung disease. In addition, if you have cough, phlegm, breathing difficulty that is not improving, you should be closely evaluated by your doctor. Some people with acute silicosis also have fever, weight loss, and fatigue. If you work or have worked in an occupation with exposure to inhaled silica, have a cough, phlegm, or breathing difficulty, you should be evaluated for silicosis. And it may take multiple doctor visits and tests to diagnose silicosis. Once diagnosed, expect long-term monitoring and follow-up. You will also need to take measures to avoid further exposure. So yeah, like how it's diagnosed, you know, they do stuff like breathing tests, CT scan, bronchoscopy. I don't know how you pronounce that, or biopsy of a lung. But yeah, I remember when I went to job, they had breathing tests, so they would have you do all these type of stuff like squatting. They would have you blow into this device to test your lung capacity. So if it wasn't at a certain level, then you couldn't work. But they tell you, but I should read how it's treated. Yeah, like I said, no cure. Yeah, prevention is the best way to avoid disease. But the best way to avoid it is best way to prevent it is to have the proper equipment. So if you can, it's like best to get a rebreather. But if you can get a dust mask, you have to kind of monitor how much dust is getting on the mask. Because if you get too much, you're gonna have to change the mask out. Because if you have a mask, it's collecting too much dust. You have to you have to change it. Otherwise, it's you might as well not even have the mask on. So pretty much they tell you what to expect is, you may have a short lifespan. I'm not gonna read word for word. I'm just gonna summarize it. But there are ways to manage disease like quit smoking. They say get a yearly vaccination such as I don't know what pneumococcal I don't know what that is. And influenza. Be vigilant about watching for development of TB or other infections. Avoid further exposure to silica. Educate yourself about the disease. Consider enrolling in clinical trials and have a plan to manage flare-ups of the disease. Oxygen support and other ways to manage chronic lung failure, like non-invasive ventilator devices, may be needed. So the Lung Association has a hotline, 1-800 Lung USA, to talk to a trained professional, and questions you can ask your doctor about silicosis or what tests you need to confirm your your diagnosis. How can the disease be monitored? What choices do I have to assist my symptoms? What is the prognosis for my situation? Are there any advances in therapy? Are there any counseling resources available? Where can I look for information on methods to obtain compensation? What other options help me quit smoking? Available to help me quit smoking? What vaccines do I need? Do I have myelofibrosis? Do I need a lung transplant? And they give you ways to avoid silicosis. So these are the steps you will need to avoid this. So yeah, you would need equipment and clothing because if you have clothes that have dust all over them, silica dust on them, that's gonna spread in the house. So if you have it, it's better to have it outside or somewhere where it's far enough away where you don't have to worry about people. We don't have to worry about breathing that dust or having it there. So so they give you civic steps to take while you work. Avoid working in dust whenever possible. Know what causes silica dust at your workplace. Even if you cannot see the dust, you can still be at risk from silica. If there's visible dust, you're almost definitely at risk. So use water, using water sprays and ventilation when working in confined structure. Lower the amount of dust, including the water hose, before it becomes airborne. Use saw that adds water to the blade. Heard about them. Use drill to add this water through the stem. That adds water through the stem and or have dust collection systems. Use blast cleaning machines or cabinets to control dust. Yeah, yeah, that was a big thing when I had safety meetings was to use to spray water on the surfaces so the dust wouldn't fly up because when you're dropping things or you set something down, dust flies up. It flies up in your nose, and unless you have a mask on, it's just gonna be bad for you. Be completely exposed. Just like I'm saying, like giving you a respirator. Now, if you can't use a respirator, you have to. Okay, yeah. So if you have a tight fitting respirator, you can't have a beard or a mustache because they say they keep the respirator from sealing to your face. So keep that in mind. So they give you a list of things like going to lung screenings and other health programs offered at work, practicing good personal hygiene at the workplace, like wash your hands at the dust, pretty much make sure your nose and your face is kind of clean and dust, at least as best you can while you're there. Do not eat or drink tobacco products in dust areas. That is a good one because you're surprised how silica can get in your mouth and you can actually feel the dust in your mouth sometimes. So it's probably a good idea when you're not eating in a dusty area, what I do, I always just rinse my mouth out with some water first to get the dust particles out of my mouth that could be in there. And they say if you smoke, do not smoke in dusty areas and always wash your hands and face outside dusty areas for smoking. Yeah. Yeah, because like when you're in dusty areas, it's all over your face. Like sometimes look like, it's like black, even though the dust might not be black, but your face will start looking black. And I mean, you can visibly tell if your face is really dusty. So like yeah, big things, washing hands and washing your face. And they usually have like industrial hand soap. So they say, changing disposable wash your work clothes. Yeah, you need clothes that you just don't get dirty in. And then I guess when you get home or when you get off work, just change clothes. And you probably need it, and you'll need a definitely shower. because maybe showering if you know if you're not combing your head and you have like you have hair. If you have hair, you're gonna need to wash your hair too. So so yeah, be mindful of that. And then they put a second. Always remember to wear when you wear your desk clothing in your car, home, anywhere outside. You may be exposing your family to potentially deadly silica. Yeah, that is true. You have family, yeah, it's best to not expose them to that by changing after you leave. But I mean, I understand there's places like where like if you need to change, it's hard to actually change it anything else because the place where it's set up can't. It's hard to avoid the silica dust. I get that, but it reduces the risk. It greatly reduces the risk if you follow this. And then for third, be sure you're using the proper respirator that fits well and it's not uncomfortable. As the National Institute of Occupational Safety and Safety and Health approved specific respirators for specific situations. The type of respirator depends on the amount of silica dust which you're exposed, and the kind of work you need to do. So, if you know with occupational safety and health, that's OSHA. I mean, I forgot the association, but yeah, that's OSHA. So yeah, OSHA is really big on that, you know, safety. So like if you're not wearing a dust mask or if your boss is not letting you have a dust mask or respirator, something that can really protect you from silica dust, then your boss could get sued for that. And the reason why I mention this is because I don't think a lot of people don't know about this. And silicosis is a serious thing. It's a serious disease. I think it's classified as a disease, or at the very least a serious condition if not uh if not taking the proper precautions to prevent it. So I just wanted to give some information on it because it is important if you're working in a workplace that has a lot of dust in it, especially if it's considered a silica dust and you're around a whole bunch of it. Yeah, these it's then this information is definitely important to you because if your boss is not making sure that you're safe in the workplace around that dust, then your boss, then that company could get shut down by OSHA because OSHA doesn't play about that. And I can definitely say that because, like I said, I did a safety meetings and I'm actually certified. I'm actually OSHA 10 certified. So yeah, OSHA really doesn't play around about that. Like they have really strict rules and they really do protect people. And and yeah, these rules you definitely want to follow if you don't want to be regretting it later on. So I hope you learned something out of it. Like I said, I always appreciate the support that people give me. I hope that more people are aware of this silicosis. Like I said, I always appreciate support. So, any comment, like anything, if you want to support the $1 movement, I appreciate it. There's links you can click on, and I appreciate the support. So I'm gonna go ahead and end this stream. Not stream, end this video. Thinking I'm live. Go end this video, but I appreciate y'all for coming through. Y'all have a wholeness, balance, vibration, people, and y'all have a great day. Talk to you guys soon.